Welcome to CANVax's webinar series. Between fall 2019 and winter 2020, CANVax is hosting a series of webinars that explore current and emerging topics in immunization. Our purpose of hosting these webinars is to support and inform the work of public health professionals to improve vaccine acceptance and uptake. To learn more about our upcoming webinars, please visit our website at canvax.ca/CANVax webinar series, as indicated in the link you see on the screen. Before we begin, we want to acknowledge that CPHA's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and CPHA is grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. Today's webinar, Vaccine Injury Compensation, a complex conversation, is brought to you by the Canadian Public Health Association through the CANVax project and its partners, Immunize Canada, the IWK Health Centre, and the Institut National de Santé Publique de Quebec. I'm Antonella Pucci, CANVax Project Officer with CPHA, and I'll be the moderator for this webinar. Assisting me on this webinar is my colleague Ruten Zhu, who is also a project officer for CANVax. As for a bit of housekeeping, it should be noted that we are using the Zoom platform for all our webinars. Our attendees on the webinar are muted. However, the toolbar located at the bottom of your screen offers you a few interactive features. For this webinar, the Q&A feature will be used to pose questions. If you have any questions, please post them in the Q&A box. Only you, myself, and the presenter can see your questions in the My Questions section, and you as the attendee have the option to submit them anonymously. When asking a question to the presenter, the question is first read out loud, answered live by the presenter, and then posted in the All Questions section. If you have any questions regarding technical difficulties, please also ask them in the Q&A box, and we will reply to you. If multiple people are experiencing the same problem, we'll address it live. Likewise, you can also contact Ruten via email at rxu@cpha.ca. We strongly encourage attendee participation and look forward to hearing your thoughts and questions. Please note that while we welcome all questions, the following questions will not be answered. Questions about the presenter's opinions and personal beliefs, and questions about who has been interviewed for the project, as this is confidential information. Myself and Ruten will be moderating these questions. So feel free to submit your questions at any point during the presentation by using the Q&A feature at the bottom of your screen, and all questions will be answered in sequence at the end of the presentation. So finally, here are just a couple of quick notes before we start. Our webinar is being recorded and will be made available on canvax.ca and on CPHA's YouTube channel shortly after the presentation. Also, please note that after the end of this webinar, you will be invited to take a short 5-minute survey. We strongly encourage you to take this survey to provide your feedback so that we can assess your satisfaction and identify areas for improvement in the delivery of these webinar series. Further, if you haven't already registered with CANVax or subscribed to our newsletter, visit canvax.ca today to do so. So with that, let's begin. I would like to introduce our speaker today, Sandani. Sandani is a recent Master of Arts, She is a recent Master of Public Health graduate from the Dalla Lana School of Public Health at the University of Toronto. Her professional background includes training in policy analysis, implementation research, and knowledge translation, which she currently applies in her role with the Office of Global Public Health Education and Training at the University of Toronto. Sandani's research interests include immunization policy, specifically as it relates to legal issues of vaccine safety and adverse events following immunization. She has also led analysis of relevant policies on a national scale that has garnered attention within and beyond Canada. This work with the Simcoe-Muskoka District Health Unit has been presented at numerous conferences, including the 2018 Canadian Immunization Conference and the 2018 Public Health Conference hosted by CPHA. Sandani has also authored various academic reports, editorials, and briefs on the aforementioned topics. And with that, I'd like to turn it over to Sandani.
All right, so thank you so much for the introduction, Antonella and Rutian. Is this a good time for me to switch over to my slides then?
Absolutely.
All right, so we'll do that. Okay, so as was mentioned today, I will be engaging us in a complex conversation around vaccine injury compensation. Okay, so I'm on the first slide right now. Hopefully everyone can see that. If not, I think the best way, just let us know through the chat box option. So as I was saying, today I'll be kind of walking us through the vaccine injury compensation conversation in a Canadian context. I'll begin today's webinar discussion mostly talking about the project that I worked on with Simcoe Muskoka District Health Unit and the Vaccine Preventable Disease team that was there. And that work was conducted in the summer of 2017. And then the second half of today's discussion I'll use to actually talk about what's new and some changes that have happened since we undertook that study in 2017. I also, just before we begin, want to mention that this work has, gone much farther than we ever could have imagined and really garnered a lot of attention on a national level. And honestly, myself and the Vaccine Preventable Disease team have been consistently sought for more information. And really and truly, it's interesting for us to see how much of an appetite there is for this dialogue. And so speaking on behalf of Simcoe Muskoka District Health Unit, we're very happy and excited to be a part of this conversation. So just before I begin, I'll state that I have no conflicts of interest or affiliations to disclose. All right, so as I mentioned, I'd like to begin today's presentation with providing a little bit of background on how it all started and why we even started looking at this at Simcoe Muskoka District Health Unit, or SMDHU. So predominantly our interest was sparked by a number of news articles that had surfaced a number of years ago. One of those was Andre Picard, as an example, that's shown on the slide here, this article from 2011. And many of these articles refer to this concept of vaccine injury compensation or no-fault compensation, which essentially means providing compensation to individuals who experience a serious adverse event following immunization, also known as APHIS. So after reading some of these articles, our initial impression was that this is a really important topic, and we thought, we need to do a little bit more research on this. We were sure that we'd find a lot of interesting evidence on this. And furthermore, we thought this would be an excellent opportunity to bring vaccine injury compensation, or VIC for short, to the attention of the Association of Local Public Health Units in Ontario, or ALPHA. So to reiterate, our initial objective, we're thinking, was that we could investigate VIC further and put together a proposal for ALPHA, again, thinking that there was a lot of evidence or information. We also felt that this was a fitting project to do as a health unit, considering that health units in Ontario are largely responsible for reporting and tracking these APHIS. But while the impetus for starting this work and the project were fairly clear, our objectives actually ended up changing quite a bit along the way for reasons that'll become a little bit more clear later on in the presentation. So delving a little bit into the background, our understanding and knowledge of VIC, especially in a Canadian context, was largely informed by an article published through the Monk School. And that's the article that's posted on this slide right here. And it was published in 2011. And through this article, we came to learn that there were, several different compensation programs or policies available worldwide, but that in Canada, Quebec was the only province with such a program. And interestingly enough, this article probes further as to whether Canada as a whole should implement a VIC program. Along with this report, we were also familiar with a couple of discussions at the Canadian Immunization Conference, and that was in 2010. But beyond these two kind of discussions, we didn't really see any further discussion or conversation, and we're really curious to know why that might be the case, or whether the dialogue in fact did continue on. So ultimately, that helped to form our research question, which was to explore the current state of evidence or dialogue on VIC in a Canadian context. To begin, we actually mostly focused on peer-reviewed articles, and we searched through 3 different databases, but we found was that there was actually very limited evidence or limited research, especially in a Canadian context. That was quite surprising to us. As I mentioned earlier, we imagined that there was actually a lot of evidence on this, but given that there wasn't, we then decided to try and triangulate our findings by extending our investigation to gray literature, as well as interviews with subject matter experts. So I'll take the next few slides to review our findings from each of those components. Starting with the literature review. A majority of the evidence that we retrieved was primarily descriptive in nature, but nonetheless really informative to help us understand the implementation of VIC, in particular as it relates to the logistics. So through some of these articles, we came to learn that there are about 19 jurisdictions worldwide that have a vaccine injury compensation program. All of these different jurisdictions have applied the compensation programs a little differently. They look different. They have very different administrative components as well. In kind of neighboring jurisdictions, I'll just point out that the US and UK are both examples of countries that have this program implemented. In some of the other articles we retrieved, a lot of the discussion was around the rationale for implementation. Primarily, we observed the common reason for having a VIC program was actually very retrospective in nature, meaning they were in large part implemented as a response to a particular socio-political climate or a particular issue, one of them being costly lawsuits. So in many cases, compensation programs were actually seen as a solution to legal challenges with immunization. Similarly, in some jurisdictions, we saw that because of the costly lawsuits, there was issues with maintaining vaccine supply, with manufacturers leaving the market for fear of these different lawsuits. So compensation was also seen as a way to ensure that the manufacturer wouldn't experience any liabilities and that wouldn't impact vaccine supply. More broadly, one of the rationales we saw for implementing VIC was due to an ethical responsibility. The principles of solidarity, fairness, reciprocity, and precautionary principles were mentioned in many of these articles, and especially to support jurisdictions that have mandatory vaccinations. We also saw some articles that really focused on more of the adverse effects and some clinical dialogue trying to understand the associations between certain vaccines and negative outcomes or serious APs. One of the ones we saw most commonly was a lot of investigation looking into influenza vaccine and Guillain-Barré syndrome or GBS. We also similarly found other articles that tried to understand the potential negative outcomes of a certain vaccine. But I think what we saw consistently through all these articles is that the science was still very limited to really be able to definitively reject or accept the causality of some of these events. So beyond some of those descriptions that I just provided to you as it relates to adverse effects and logistics and rationale, we didn't really find any empirical evidence to understand the benefits or impacts of some of these VIC programs. We did find one comparative analysis on this that looked at 4 different programs, but beyond that, there were really no program or policy evaluations, so we don't know if it's cost effective, we don't know if it has an impact on immunization rates or hesitancy. And so the key point really is that the impact of these types of programs and policies remains largely unknown, especially in a Canadian context. And of course, that makes it a lot more challenging to understand whether or not Canada or any of the provinces or territories should also consider implementing VIC. So turning to our subject matter expert interviews, which we conducted on a rolling basis, we actually ended up learning a lot of information that we wouldn't have gathered through the literature review. What was interesting is that at the time of our interviews, it was actually a little bit difficult to find individuals who are aware of VIC, and similarly, there wasn't a lot of traction or appetite for having this discussion. And again, that was in the summer of 2017. Nonetheless, of the subject matter experts that we interviewed, we realized that there certainly was awareness of compensation policies, but that this dialogue in Canada has actually ebbed and flowed since the 1980s. Our discussions with these experts really helped to highlight that this is a very complex and long-standing issue. What was really neat was that we interviewed experts from multiple sectors as well, so that included public health professionals, practitioners, lawyers, and they all gave us very different perspectives on how they had come to learn about VIC and also their opinions on whether it should be implemented in other provinces and territories. One thing I want to highlight also is that our experts identified that there are still many questions with VIC. Specifically, there is continued confusion on how VIC should be implemented, funded, and administered. And this is especially a difficult question for Canada, considering the many differences that we have across the provinces and territories as it relates to vaccine policies and schedules. What we found most interesting was the conversation around Canada's sociopolitical climate, and we really learned that VIC wasn't something that was necessarily a priority, but that it could become one if VIC was deemed necessary or if there was public advocacy for this type of program. So many of our experts actually raised this question, and we didn't have the answer to it. We had no idea whether there was public advocacy for this in our search so far and in our conversation so far. We really didn't know that perspective. So that brings us to our gray literature, which was the tertiary component of our investigation and ended up being very fruitful. There was a lot of new information that we were able to gather that we hadn't seen elsewhere and likely would have missed if we had not included this component in our research. So specifically, this allowed us to find a number of lawsuits, petitions, blog posts, and broad social media engagement regarding this issue, and again, specifically looking in a Canadian context. So first and foremost, I'll review some of the legal cases that we observed, and I'll just start off by saying that there have been, in fact, several legal cases in Canada related to vaccines and serious adverse events. So some of these cases began as early as the 1980s. There are a few cases or lawsuits claiming injury from measles vaccine or pertussis vaccine. In all of these examples, these cases were largely unsuccessful. But in the instance of Quebec, and that was in the late 1980s, there was actually enough traction and conversation that led to policy change, and specifically the adoption of the VIC program in 1987. So even though the lawsuit itself wasn't successful, just the media attention that came around it helped to actually lead to its implementation. More recently, there was another case against the City of Toronto with the allegation that hepatitis B vaccination had led to severe or permanent neurological damage, and that was in 2006. Again, this case was unsuccessful, but it did generate a few interesting conversations and tons of media traction as well. The case itself was very lengthy, but there was certainly a lot of online support throughout the entire process, and a lot of blog posts and community forums that were generated both during and following this lawsuit. Coming around to about 2009, there was also some conversation around H1N1 and individuals, or several individuals, claiming adverse events such as Guillain-Barré syndrome. There was one lawsuit that was filed. To my understanding, there might have been more, and that one actually just recently closed, and there is an article about that in the National Post that if you're interested in looking into. But the point I really want to illustrate here is that there have been a few cases. Some of them have generated media attention, but at the end of the day, none of them have been successful. That brings us to the second grouping of our gray literature, which includes numerous news articles and media reports, again, as early as the 1980s, but still continuing on to this very day. And so I've illustrated a couple of examples here on the slide, and hopefully you can see them. And so at the time that we were looking, it was very interesting for us to see that there was actually active public advocacy for VIC in Canada. And one example in particular I've highlighted on this slide. If you look at the tweet that's close to the bottom of the slide, you can see that it's from July 2017 by a gentleman named Bob Martin. And when I looked further into this individual, I was able to find that he was actually actively pursuing this agenda as early as 2010, claiming injury from the H1N1 flu vaccine. So it was really interesting for us to finally see, you know, there is actually some public advocacy and public conversation about VIC in Canada. This is in parallel to a couple of other government documents that we found, and I've listed a few here on the slide. Beyond that, we also found a couple of meeting transcripts and a few other reports. Arguably, they weren't all in favor of VIC, but it was really interesting to see that there had been ongoing conversations, again, as early as the 1980s, had ebbed and flowed, and we still saw some around 2015 as well. And one of them I've mentioned here on the slide, which was a debate amongst health professionals at the Canadian Medical Health Association general meeting in 2015. So in summary, what this research really showed to us was that there might actually be some growing public advocacy regarding this issue. So in comprehensively reviewing what we learned through the literature review, through conversations with subject matter experts, as well as doing the gray literature search, we were able to extrapolate 5 main themes that I think really are 5 main gaps in knowledge or outstanding questions that we have. And this is specific to a Canadian context. The first one I've highlighted is necessity. So even though we found some public advocacy and interest for this issue, our search alone isn't rigorous or sophisticated enough to really answer this question. But nonetheless, I would argue that it's a very important one to answer to fully understand whether this policy or program is needed in Ontario or any of the other provinces or Canada as a whole. And I really think that there is an interesting opportunity to probe this question a little bit further. Acceptability was another gap that we highlighted, all to say that we don't really have much clarity on how a VIC program would be accepted by the public, what sort of impact it could have on things like vaccine uptake or vaccine acceptance, or whether it could actually have a detrimental effect on immunization rates. I recognize that that's a very challenging question and something that's very difficult to answer, but I think it still merits recognition moving forward. And certainly not only for Canada, but for other jurisdictions as well. The third and fourth gaps that are highlighted on the slide are feasibility and leadership. I think this is a little bit more specific to a Canadian context, going back to some of our peer-reviewed literature as well as discussions with experts. We found that there's a lot of confusion in terms of who would administer the program, whether it would be done at a federal level, whether it would be best done at the provincial territorial level, and similarly how it would be funded. And I think those questions are a little bit, as I mentioned, unique to Canada. And then the last gap in knowledge there is causality. And I think throughout our entire investigation, the question of causality remains very contentious. And that's true even in jurisdictions that have already implemented a program. It's something that those jurisdictions continue to struggle with because it's really difficult to understand or prove whether a certain vaccine actually led to a particular adverse event. So I think there's a really big question there in terms of how do we determine whether to compensate or not. And so in a Canadian context, there's certainly a big decision to be made there. So that, in summary, is what we found in our study that was conducted in 2017. And we took a lot of those findings to a number of academic venues and conferences and presented in various venues as well. So I'm going to spend the next little bit of the webinar to talk about an update and to provide you a little bit more information on what's been happening since then. So broadly speaking, I think there are 3 main updates that are important to cover as far as updates go. The first one is really to say that there still is ongoing interest and discussion about VIC, and that is true across academic and gray literature. The fact still remains that Quebec is the only province with the VIC program. And the last update is to say that there are still several gaps in knowledge on the impact of VIC, even though we've had a little bit more ongoing discussion in academic literature. So I'll spend the next little bit or the next few slides to go through each of those updates. The first update I mentioned was that there is ongoing interest. Specifically looking at academic literature, compared to when we started our search again in 2017, there are a lot more articles and literature. I've listed a few here on the slide that I think are particularly interesting. The first one is by a group in Ireland, Keane and colleagues, and they provide a new review, or what they call a systematic integrative review on several different compensation programs. The 2 that are listed just below that are similarly also comparative reviews. The one by Atwell and colleagues in particular looks at jurisdictions that have both mandatory vaccination policies and VIC policies, so I think that one's quite interesting. And then the 4th article there that's listed proposes the implementation of a global VIC program, although I'll highlight here that they're not the first authors to suggest such a proposal, but it is probably one of the more recent proposals for a global fund. So of course, this is not a comprehensive list, but I did highlight these in case you're interested in reading more. Going to a Canadian context, though, to my knowledge, I haven't seen any more peer-reviewed work on this topic. Fortunately, I did have an opportunity, however, to work with a number of experts across the country, and we published a brief recently on the CANVax platform, CANVax being the host of our webinar today. So I encourage you to take a look at that brief if you're interested. Provides a bit of an update and, again, a more Canadian-specific discussion on BIC. On the gray literature side of things, I find it interesting that there are still ongoing discussions here, especially in Canada, as you can see from my slide. If you remember earlier in the presentation, I pointed to an article by Andre Picard from 2011. And this article that's on the slide was actually published this past summer. So to me, it's really interesting to see that there are some individuals who have been involved in this discussion for many, many years, but also that it's still ongoing. More locally, as many or some of you might know, Toronto Public Health recently convened interest from their Board of Health on this topic as well, and mentioned or supported VIC implementation as one strategy among several others to bolster efforts to reduce vaccine hesitancy. Looking to social media, we still see some ongoing public advocacy through various platforms. There is active engagement from several advocacy groups such as Vaccine Choice Canada. For example, some of you might remember, they posted a series of billboards earlier this year, I believe in February, and I've actually provided a picture of one of those billboards on this slide, which demonstrates even their support and interest for a VIC program. Hopefully you're able to read it, but if not, that image basically shows that the USA has allotted X number of dollars for compensation, and that in Canada, we haven't been doing that. Similar to that, there are actually several active petitions and blogs that are in support of this program. Again, I'm sure there are several other examples out there, but just from my initial scanning, these appear to be some of the more prominent examples of current public advocacy for VIC. Moving on to the second update I mentioned, I find it very interesting that despite all this conversation, Quebec is still the only province with a program. In the interest of time, I haven't gone into too many details about the Quebec program, but if you are interested in learning more, there's a lot of information online, and they publish their statistics quite regularly. So if you are keen to learn a little bit more, I highly recommend that you take a look. But beyond this, beyond Quebec, there are no other provinces or territories that we know of that have considered VIC, although, as I mentioned earlier, there has been some interest expressed in Ontario through Toronto Public Health to implement VIC. And finally, moving to the last update I wanted to provide is that, again, while we do see ongoing conversation, my observation is that there are still really big gaps in knowledge. So I hope you can think back to the 5 gaps that I talked about earlier. Fortunately, I do think there has been some progress made, and that would be largely in respect to feasibility and leadership, with some of the discussions that we've seen, but not only in a Canadian context. I believe there's a lot more comparative analyses and comparative studies that really help to illustrate the different pros and cons to different strategies, again, as it relates to more of the logistics or administration of the program. So I think in that sense, if Canada or if any of the other provinces or territories choose to pursue this, there's a little bit more evidence that they can rely on and to support their decision-making around how to create this kind of program. However, what we still don't know a lot about is the acceptability of this kind of program, how it would impact immunization rates, or how it would be perceived by the public. I would further argue that we don't really have a good understanding of necessity. And I think in the Canadian context, that's a really important question to be asking as well, in terms of, what do we even mean by compensation when we compare to neighboring jurisdictions such as the United States? Having that compensation certainly supports people who might not have the means for certain medical care. But in a Canadian context, I think it's really important to ask, if we do provide compensation, what are we compensating? And that's something that still remains a little bit ambiguous. And of course, I think The other really big gap is the scientific literature as it relates to causality. By no means am I an expert in this area, but having had several conversations with other experts, it really seems to be a big challenge for understanding how to make some decisions around compensation for vaccine injuries or serious adverse events. So that's a lot of information. Where does that whole discussion leave us? On the one hand, this work, I think, really illustrates that this is a timeless issue. While it is very confusing and very complex, we can very clearly see that there's ongoing discussion. And arguably, we may continue to see that discussion so long as we have these various vaccine programs and policies in place. By that same token, VIC is also a very timely issue, especially in our current climate of vaccine hesitancy. We might actually see some growing interest and need for a VIC program, especially through the different social media examples that I provided to you. This might be something that we actually have to prioritize in the near or distant future. I'll also just quickly mention here that VIC was something that was recently prioritized by the National Immunization Strategy. And again, we have the example of Toronto Public Health and their recent support for VIC as well. The last thing I really want to just mention is that when we started this work back in 2017, there really appeared to be no continued conversation. But almost 2 years later, this is a discussion that has persisted, but it's also interesting to see that it comes up along any conversation about mandatory vaccines or vaccine hesitancy. So the bottom line of this conversation is really to say that it is a challenging immunization issue. It's one that's far-reaching, but I also think it's one that requires our due diligence in
Sandani, I think we can't hear you at the moment. Hello?
Hi.
Hi. You stopped sharing. Yeah, you stopped sharing your slides.
Interesting. Okay. Where did I stop sharing it?
The summary one, the last one.
Okay. Can you see it now?
Yeah, yes.
Okay.
All right.
Sorry about that, everyone. But you heard everything I said?
Not all of it, not the last part. Yeah,
okay.
The key point part.
The key points. Okay, so to reiterate then, apologies everyone for that technical difficulty. What I had said was that this really is a challenging immunization issue. It's one that is also very far-reaching, but I also think it's an issue that requires our due diligence in exploring to ensure that we're aware, prepared, and responsive to immunization-related needs in Canada. So that brings me to the end of my presentation. Again, the references are at the end of the slides if you're interested, and I'll pass it along to Antonella and Rutian.
For sure. Thank you so much, Sandani, for your presentation. At this point, if you have any questions, please submit them using the Q&A feature. And also just please note that questions regarding personal opinion or questions about who was interviewed in the project will not be answered. So feel free to just start typing in the Q&A box. So as I see as there's no questions coming in, that brings us to the end of the webinar. So thank you all for joining us on the webinar today. And thank you so much, Sandani, for presenting on this topic. It's very interesting and very informative. So as a reminder, please don't forget to fill out the survey and provide your feedback. The survey will be made available to you upon the closing of the webinar. So, and once again, if you do happen to have any questions for Sandani, feel free to contact CANVax or Rutian. Thank you for joining this webinar and have a lovely rest of your day.